Hello everybody, I'm Patty Patane. I thought it was time for an update on the art of Dr. Ronald Fragen.
I'd like to introduce you to one of our mommy makeover patients. Her name is Denise. She is a mommy ×2, and she found herself in the similar circumstances most mommies out there after we have our babies and our bodies change. Dr. Fragen has helped her to change her body, make her feel better about herself. She's a professional woman out there working, and this has just made her feel wonderful about herself. A mommy makeover basically consists of liposuction, breast augmentation or breast lift. Also, it can include a tummy tuck or an avalar, which is a combination of liposuction and removal of excess skin on the abdomen area, and that's the lower abdomen. We make every effort to put these incisions in places that you're able to wear a bikini and be out there during beach season. So we'd like to invite you in for a complimentary consultation with Dr. Ronald Fragen here at the Fragen Cosmetic Surgery Center in Palm Springs at 760-327-1226. I'd also like to mention to you, there is also for those people that would like non-invasive procedures, we also have those available as well. Doing liquid facelifts, lunchtime peels. There's all kinds of things that we can do. So please, take some time today to give us a call.
You may remember the magical transformation of Arlene. Now let's move forward about 10 years and take a look at this.
I want you to meet Betty, who came to my office about 7 weeks ago. And she came in and she was really set on getting a bunch of things done. She wanted to get her nose shaped, she wanted her face and neck shaped, she wanted her body shaped. She really had some very specific ideas of what she wanted. She'd researched it. It's one of the things that we love to have about patients who really look at things and know what they want, and then we try to advise them of what will be the best things for them. When Betty first came in, she came in with a girlfriend from her hometown, and both of them had consultations about what they wanted to do. Betty, why don't you tell us what it is you really wanted to accomplish?
Well, I guess what I was looking for was, the old saying, growing old gracefully. I didn't feel that I was. I looked very tired, depressed, grumpy, and I definitely wanted to change that. I knew I was coming down to Palm Springs and that I'd be here for 3 months, so I did my research on the internet, and I kept coming back to your website, which I was very pleased with it. It was very thorough, honest, and I was quite so impressed with you because you said you felt like an artist and that you were passionate about what you did, and that meant a lot to me. So I kind of knew that you were going to be the one.
Well, one of the things that I really try to accomplish with everybody is to look at them as though I'm a sculptor, saying here's where the clay started and here's where I want to end up. And I think for doctors, when we do this, we can accomplish it fairly quickly and easily because we know where we're going. If you start out and don't know where you're going, then it takes a long time to get there. And particularly with you, where you had several things done, it was important that I had a concept in my head of what I wanted you to look like when we were done, and you were real helpful in helping me understand that.
Yes, knowing what I wanted, and what I felt was very impressive was that you accomplished what I wanted.
Yep.
And to me that meant you were listening.
Well, one, I do try to listen to people, and the part of what I try to do also is talk to people about what I want to what you want to have accomplished and what I want to have accomplished. And if those things meet, then you're at the right doctor and I'm with the right patient. And we're trying to do the same thing. I think one of the things for the people to realize is that if you go into a doctor's office and he's talking about doing X and you want to do Y, you're probably in the wrong place.
Yes.
With it. So we really, I think that the more you understand about what we want to do and the better we are at communicating that, the less anxious you will be throughout the procedure.
Yes, and I was going to say my consultation, how comfortable you made me feel right off the bat. I knew right now that this is what I wanted to do because you were the first person that I felt understood what I was saying. You
Thank
know,
you.
and felt very confident to put myself in your hands.
Well, thank you very much.
And I'm very pleased, I have to.
The thing that I really liked about Betty, particularly after we accomplished what we did, was your feelings about how people treated you before and how you were treated after. And I think it's a shame, but in our society, if people look pretty good and attractive, we're open and friendly towards them. When people sort of don't look real attractive, we ignore them and they become almost shadow people. And I think you told us about some of your experiences.
Well, you know, you always say don't judge a book by its cover, but if you're in a crowd of even people you know, and you're looking tired and you're looking grumpy or you're looking depressed, I have to admit that people do tend to stray away from you because they're not sure. And even little children, you know, they look at you, they have their doubts. Is she grumpy? Should I go near? And I mean, I feel that I felt I needed to change that. I need to look more welcoming.
And I think the thing that I love is when you came back in, and particularly the way you dress, you can wear now fitted clothes. You came in with a big smile on your face, going, wow, people actually pay attention to me now.
Yes.
And that's huge. And I really think the whole psychological part of what we do is very, very important.
I have a little story I wanted to
Go
tell
ahead.
you, a little experience I had while I was down here. When I first arrived in Palm Springs, of course I had to go to a large store and I need someone to help me. I spent a half an hour chasing clerks all around the store because they will turn on their heels, and of course that's a norm. I felt that was a norm. And you know, they'd turn and run or they got busy with someone else or whatever, and I thought, oh, you know, it took half an hour. After the surgery, I went into that same store and every clerk I passed said hello, good morning, smiled at me, I had eye contact. And when I walked out of that store, the Palm Springs sunshine's coming down on me, and I went, oh, this is going to be a beautiful day, you know.
Wonderful.
So, yeah.
Wow, I think that's great. Let's talk about a little bit about the specifics of what we did with you. One, when Betty came in, she had a very full neck. She had huge creases from her nose to her chin. Her face was pretty flat. And one of the things that happens when we get older is we lose volume in our face. So our cheeks get down by our mouth instead of up by our nose where they belong. And so one of the things that we really needed to work on with Betty was not just lifting her face and tightening her skin, but actually adding some sculpture to her face and some volume to it. So what happened, if I can lean over here, is you can see her cheek actually turn a little bit that way. You can see she's got her cheek and she's got some cheeks that was very flat before. And this area was really dented, and it's much less so. And underneath her eyes was real hollow, and now that's better. So what we did is we did her eyes, we took some extra skin out of them. Her nose had a little bump on it, and it was a little wider in the tip. One of the things that was really nice about doing your nose, and what I do when I do noses, is to figure out exactly what you want to do, because you don't have to take the whole nose apart to accomplish certain things. Some doctors learn this is a nose surgery, and so they take everything apart and then try to put it back together. Well, that leads to much longer healing, much more complications, and much more problems. This way, what we were able to do came out very simply. In addition to that, we put some cheek implants in her and added some volume along her jawline. And then we really dramatically changed what was going on with her neck. So she now has a nice platform there where before her chin faded right into her neck. And I think the idea was that you went from being very plain, and now when I see you, your hairstyle's a little different, you've got a little more makeup on, you're smiling more, you're just a happier person.
Yes.
And I think that's really wonderful and a lot of what we want to accomplish. The other thing is we added a little volume to your lips. You had very, very thin lips. Your lips look perfectly normal. They're not big Ubangi looking lips or, you know, like some of the actresses.
I look like me.
And you look like you. And what we wanted you to do, and what I really try to accomplish, is to make people look like they looked 15 years earlier rather than like a different person. When we started, when Betty came in, her abdomen basically was out as far as her breasts. And she had a very straight waistline. And now, if I can pull this back on you a little bit, you've got a waistline. This goes in from side to side. You really look great. If we turn you just a little bit, you can see what's going on with her. She has a fabulous shape. And the idea is it allows her to wear the kind of clothes that she's always wanted to wear, but before couldn't. And we find many women, and men too, that when your tummy gets too big, you've got to dress around it. I'm getting to that point now. But the idea is when it's down, you feel like you want to wear clothes, you want to wear styles, you look good. And really the amount of energy that we each put into how we look and how we dress is huge. So by fixing this, it makes you match the youthful look of your face rather than if we just did your face and you still had your big tummy sticking out.
Yes.
She also used to have saddlebags in her hips and where this stuck way out. And you know, we've all seen that with women. If you wear tight pants and you walk, you get the little scrunch back here that sticks out, the little pillow. And we eliminated that for you. And now your clothes fit loose instead of tight. And she can wear anything she wants. So it's just great.
Yes,
and we love it. And I think the other thing is with you standing up and taking a picture of your face, if we look at the overall view of Betty, she is an attractive looking 40-year-old, and she isn't, and she isn't 40. But the idea is that we love what's going on and love to be able to create this for her. If you look at Dawn before, she had big bags under her eyes. Her brow looked a little sad, it was down. Her cheeks were down, she had these big lines around her mouth, and she always had a relatively heart-shaped face, even when she was very youthful. So her chin is more prominent and it almost looks like there's a little dent around them. And that look, she actually wanted to keep to some extent because that's what she used to look like when she was younger. But what, again, we tried to do was take her cheeks back to where they belong, get her eyes so they look like normal eyes, and get her mouth rehabilitated, but yet to still look like her mouth. Because she started off with very thin lips. If we would have given her very fat lips, it would not have looked like her.
Well, my name is Maylene, and I'm Dawn's sister. I'm approximately 11 years older than Dawn, and I had my surgery here in 2004 at Dr. Fragen's. Some of the comments I used to get before my surgery were always, "Have you been well? You look tired. You look so tired." And that was kind of an indicator too for me to, it kind of pushed me into the surgery or thinking about it, because I got it a lot. And then people started saying, "Oh, you look well. What have you been doing exercises? Have you done something new? Your hair, what have you done?" But so it was not obvious that I had had any surgery on my face. And that was comforting to know, because you look in the mirror every day, you get used to it. But when other people, and it was the same with Dawn, I think, even though she works here and she's seen the same thing, she was a little anxious, but you know, you still feel very confident because you've seen the results that other people come in and out, and so you kept thinking, no, it's going to be fine, and it was.
This is Dawn and her sister, and this is the day of surgery for Dawn. And we're going to go through with you how we greet people, bring them into the operating room. We don't kiss everybody, but a lot of people. And what we do. And it's very important. We have our own private operating room, which is not only certified, but it is state licensed and Medicare certified. So therefore, it is the same standards like the hospital's outpatient surgery. We have an anesthesiologist, we have nurses, and you will see in this picture another doctor from Texas who actually came up to watch how I work and what I do. Now, you can see in here I'm showing the lip, and you will see Dawn's before and after picture. Her lips are very thin, and there's an area that I call the pillar of the lip, which is just underneath the lip and into the crease between the lip and the chin. And that area gets very thin in people as they get older. And it's very important to build that up to give their mouth a youthful look and also help the corners of their mouth not sag down. One of the reasons they sag is because you lose volume. Also, you can see this whole area along her jawline, which we're going to fill up with some fatty tissue, and also this pillar of the lip area when we get done. You can see that I've drawn on her face the areas where we're going to put some fatty tissue to fill her face. Those lines that look like whiskers are along there to help her cheeks get a little bigger. And then we're drawing along where we're going to make the incisions next to her ear. And the incisions that we make go inside the ear so that after surgery, you really have to hunt around to find any of these incisions.
Patients come in all the time and ask if I've had something done or my face done, and I said yes I did, and I show them my before and after pictures, and they just go, wow. You know, they just, you know, think it's wonderful. And in fact, one of our ladies that we just did the other day, after she saw my before and after pictures, her boyfriend was real leery about her having a facelift because he didn't want her to have that pulled wind tunnel look. That was his biggest fear. And so she came in and I showed her my before and after pictures, and she just, you know, goes, okay, that's it, I'm going to do it. And because she liked the fact that I still had, you know, a few of my expression lines and I wasn't pulled, and her boyfriend then saw my pictures too, and that, he said, that's it. He was excited for her because he realized that she was in the right place and in the right hands, that she was not going to have that pulled look, that she was still going to look like her and have her few of the lines and look natural. And
I think what happens too is I don't think there's one of us women, and probably men too, that haven't stood in the mirror as we age and you go and kind of think, oh, that's kind of scary. But then if you get it just right, you think, yes, I like that. And that's what Dr. Fragen does. He gets it just right.
Hello, everybody. I'm Patty Patane. As many of you know, since 1992, I have relied on Dr. Ron Fragen to take care of my face. And he has, very nicely, I might add. He does things that don't allow me to look as though I have had work done. He does what is called age appropriate. But as we age, we have a tendency to lose that elasticity. And even though I had a little work done back in 2014, things don't stay the way they used to. So Dr. Fragen has come up with a new way to just keep me kind of nipped and tucked. It's not really nip and tuck. What it really is just some little tiny fillers around my lips. And we're going to demonstrate that today. Now, over the years, Dr. Fragen has, if he wants something on my show, he uses it on me first. That's the key. And that's what we're doing today. This is a relatively new product, and we are going to use it on me for the first time, and I am going to let you all know that we're good to go.
As you know, Patty has little or no pain tolerance. So therefore, what we're going to do is a dental block to block her upper and lower lip and this area in here. Patty had previously had a facelift and had filler put in, but fillers basically have to be re-put in again. So part of this program of fill, finish, and relax is using Xeomin, which is a botulism toxin kind of thing, to relax the forehead in these areas, to fill the deeper areas, which would be here and a little bit in around the lip, with another filler that lasts longer called Radius, and then we use Bolatero, which fills in these little tiny fine lines. And so what we hope to do is rehabilitate it, and this is what we can do when we do facelifts and other surgery on people. They don't last forever, and there's a certain point in time when little things occur, and what we try to do is fix those little things as they come up, so you stay looking really good.
Well, the older I get, the lesser it lasts. Is that right?
That's correct. This is Christine, and with Christine, what we see is a little drooping in here, which makes her chin look a little witchy and a little older. So if we fill that in, it'll look better. She has these little dents in here that will do that and make it better. So if we fill these areas with Radius, and then we finish by giving her a little more lip line, a little fuller lip with the Bolatero, which helps fill in these little tiny lines. And then the relax part is to use Xeomin, which is a neurotoxin. This is the muscles that pull your brow down, and this one, frown again, in this one. And what we do is by relaxing them, we let her forehead muscle, the frontalis, pull her brow up. So it just opens her eyes a little bit and makes her look a little more youthful. One of the things that I am very passionate about is the fact that I think anybody doing cosmetic surgery should have some artistic training. Because what happens as you think like an artist as opposed to just a surgeon. And to give you an example, for a surgeon, it's where's the muscle, what's the origin, and what's the insertion. For the artist, it's what is it that makes the cheek pretty, and how do I emphasize that? What is it that makes the jawline pretty, and how do I emphasize that? What is it that makes the S curves in the body and makes those pretty? So that when I sculpt people, I think about when to add and when to subtract and what parts I want to emphasize to make them look beautiful. Now, this happens to be the first piece that I ever sculpted, and it was very interesting. I was taking a course at the New York Academy of Arts, and the model who was sitting for the class came off the podium actually and said, "This looks more like me than anybody that's ever been in any of the classes," and I've done hundreds of classes with students in them. And the reason is when I looked at her, I saw that her jawline was not symmetric, her cheeks were not symmetric, her mouth was not symmetric, her eyes are different, and I actually sculpted that the way I saw it rather than just a face with eyes, nose, and mouth. So we have to apply the same things when we sculpt people. In other words, I'm emphasizing each person's individual best characteristics, not just generically making them look like they've been operated on. And we can see many examples of people who have not had an artist working on their face. If you look at the bad examples in Hollywood and some of the windswept faces that we see.
I'd like to introduce you to one of our mommy makeover patients. Her name is Denise. She is a mommy ×2. And she found herself in the similar circumstances most mommies out there after we have our babies and our bodies change. Dr. Fragen has helped her to change her body, make her feel better about herself. She's a professional woman out there working, and this has just made her feel wonderful about herself. A mommy makeover basically consists of liposuction, breast augmentation or breast lift. Also, it can include a tummy tuck or an avalar, which is a combination of liposuction and removal of excess skin on the abdomen area, and that's the lower abdomen. We make every effort to put these incisions in places that you're able to wear a bikini and be out there during beach season. So we'd like to invite you in for a complimentary consultation with Dr. Ronald Fragen here at the Fragen Cosmetic Surgery Center in Palm Springs at 760-327-1226. I'd also like to mention to you, there is also for those people that would like non-invasive procedures, we also have those available as well. Doing liquid facelifts, lunchtime peels. There's all kinds of things that we can do. So please, take some time today to give us a call.
If you look at Dawn before, she had big bags under her eyes. Her brow looked a little sad, it was down. Her cheeks were down, she had these big lines around her mouth, and she always had a relatively heart-shaped face, even when she was very youthful. So her chin is more prominent, and it almost looks like there's a little dent around them. And that look, she actually wanted to keep to some extent, because that's what she used to look like when she was younger. But what, again, we tried to do was take her cheeks back to where they belong, get her eyes so they look like normal eyes, and get her mouth rehabilitated, but yet to still look like her mouth, because she started off with very thin lips. If we would have given her very fat lips, it would not have looked like her.
Well, my name is Maylene, and I'm Dawn's sister. I'm approximately 11 years older than Dawn, and I had my surgery here in 2004 at Dr. Fragen's. Some of the comments I used to get before my surgery were always, "Have you been well? You look tired. You look so tired." And that was kind of an indicator too for me to, it kind of pushed me into the surgery or thinking about it, because I got it a lot. And then people started saying, "Oh, you look well. How have you been doing exercises? Have you done something new? Your hair, what have you done?" So it was not obvious that I had had any surgery on my face.
The idea is when it's down, you feel like you want to wear clothes, you want to wear styles, you look good, and really the amount of energy that we each put into how we look and how we dress is huge. So by fixing this, it makes you match the youthful look of your face, rather than if we just did your face and you still had your big tummy sticking out.
Yes.
She also used to have saddlebags in her hips, and where this stuck way out. And you know, we've all seen that with women. If you wear tight pants and you walk, you get the little scrunch back here that sticks out, the little pillow, and we eliminated that for you, and now your clothes fit loose instead of tight,
Can wear anything.
and she can wear anything she wants. So it's just great,
Yes,
and we love it. And I think the other thing is with you standing up and taking a picture of your face, if we look at the overall view of Betty, she is an attractive looking 40-year-old, and she isn't, and she isn't 40. But the idea is that we love what's going on and love to be able to create this for her.
I served, and I speak for those who cannot. U.S. Army Chief Warrant Officer Suresh Kraus, a Black Hawk helicopter pilot killed in action, Afghanistan. Ming Sun, a U.S. Army Private First Class, killed in action, Iraq. Both Cathedral City High School graduates. Neither Suresh or Ming were born American citizens. They joined our military and fought for freedoms they wanted to call their own. Ming joined the Army to become an American citizen. Suresh joined to repay what's been given to me after becoming an American citizen. They died wanting and thankful for what so many of us take for granted. I served, and I speak for those who cannot.